Myself, Dr.Nanthini Saravanan. I'm an obstetrician and gynecologist and also assistant professor and office in charge, working in the rural unit of Jawahar Navodaya Institute of Postgraduate Medical Education and Research, Karaikal. Basically, as a teacher, it's my role to impart the knowledge to my students, not only to clear the exams, but to extrapolate their knowledge to a community care. They should be able to impart this knowledge at a community level, at a grassroots level. So, to inculcating this into the young minds of the medical graduates is the motto of my journey. And as an initiative of cancer screening program for women in this rural district, our former district collector had innovated a program called Makkali Thedi Mavata Achiyar. By this program, the undergraduate medical students, along with me, they used to travel to the rural units, doing a cancer screening program, imparting a knowledge on the women cancer or genital cancer is a big challenge nowadays. To give this knowledge to the students and empower them to communicate this at the community level with the learning material available at the rural unit, which the rural population can easily connect. We have nearly screened the entire 5 villages in this rural district, and we also picked up quite number of positive cases, and nearly 27 patients are on follow-up with this malignant cases. Though I have got graduated as a best outgoing student from Christian Medical College, Vellore, as you all know, it's one of the reputed national level institute. I have made a decision of coming down to my rural unit because give back to the society is one of the prime aim of every medical graduate. Those who are graduating from the Indian government should also have this knowledge, also have the dedication to come back to the community and serve, which will be recognized. Don't have to, for a longer time, people used to think living in the metropolitan city and serving the rich is only way to earn money or get a grade. Slowly, my students, those who are non-regional language speaking students, also started to learn the language to communicate this to a community. It gives immense pleasure as a teacher. As a student, they are also imbibing this at their initial stage of life. This particular work by the undergraduate students of this institute been recognized by the government of Puducherry, and they have honored them with a medal and awards. As a medical doctor, as a teacher, I have received a lot from my teachers and my community, and it is my turn to give back to the society. Say, for example, demonstrating a uterine growth by showing a papaya model, showing a cervical cancer with the help of a capsicum. So, educating the rural population or people who are not well educated, not loaded with the information about the health is a real challenge. To make them understand in their simple language or the locally available products or with the models, simple models is a big challenge. For undergraduate to explain, again, it needs a lot of training and practice. As a teacher, it's my duty to impart this. So we have made a small model with available paper cups and a rubber band, and we are using this to demonstrate the common public, to show the size of the cervix, also to show them how this cervical cancer screening can be done at the community level, because it's a challenge to convince this population to come for a screening at the community level with a provided privacy list. So we used to teach them with a model, small models, which will help them to understand what exactly the procedure the doctor is going to do at the community. So I have trained the students on gender sensitization, menstrual hygiene, also about their sex education being taught at the school levels with the initiative from the school programs, and also we have I'm having regular training programs for the nursing students. Mother Teresa Institute of Health Science, also other 2 private nursing institutes in this district also benefited by the regular teaching and conducting regular workshops for hands-on training. Not only that, the districts in the rural hospital or a medical sector cannot survive only with a specialist. With very few people, a specialist cannot take care of the entire health sector of the rural unit. It's also very important that we train these medical officers to qualify, to empower them so that the health care of the district can be improved. With this motto, I have trained every year regularly for the medical officers of the Karaikal district. Has been done twice in a year, about 2 days workshop being conducted regularly in the last 5 years. The ASHA workers, ANM workers, also the ICDS workers of this district being empowered with a regular teaching and also with a workshop conducted for this ICDS workers. Newborn Young Child Feeding Foundation. I'm one of the executive member of this foundation, imparting the health breastfeeding awareness among this community level. Also helping this antenatal and postnatal mothers at the grassroots level. Also a part of my teaching plan, and it has been executed in the last 5 years. During the COVID pandemic, where the whole world was shut, we have made a decision to come down to my district, and I have taken a voluntary I have provided a voluntary free service to the entire 2 years as a tele-doctor, also contributed my surgeries, and also contributed to the district hospital, being nominated as one of the specialists to a district hospital to serve as a free service in case of obstetrics, emergency gynecological surgeries, also providing a regular gynecological care. And in recognition of this, the Pondicherry government has recognized me with a COVID warrior and Anna Teresa Social Service Award for the same. And when we move on to the district government hospital initiatives, though it's a small hospital, this is the first ever laparoscopic hysterectomy surgeries, where previously it used to be by the doctors from Puducherry used to travel back to the Karaikal to perform these surgeries. These surgeries were unaffordable by our poor patient, had become regular routine surgeries, nearly performed about 55 laparoscopic surgeries in the last 5 years. And these initiatives had made a real change in the healthcare system at my district. We have published nearly 6 cases which are very unique, and considering their rarity we have published. Also we are adding it as a clinical booklet for our medicos. The journey of this medical doctor was not indeed on a bed of roses. It has lots of thorns and struggles over a period of time. I was born in a small village, and the story of all, as usual, barefoot walkers of the nation, and the journey started. And poverty was never a bane, it was a boon for me, which gave a happy family, and I happened to study in a Tamil medium school till 5th grade. Got the opportunity to study in one of the residential schools, Jawahar Navodaya Vidyalaya, reputed school across the country. And after pursuing my 12th grade, I happened to meet a sickness of my father, and though my dream was to become a doctor, I have started my life career as a nursing professional. Later on, after 2 years, I have pursued again my medical education. I completed my medical schooling, pursued my post-graduation, and also to work more than a decade in a prestigious institute, Christian Medical College, Velo. Needing to say that average of 2,000 deliveries per month is the workload of Christian Medical College. Worked for more than about 11 years in that, which approximately calculates more than 10,000 deliveries and complicated surgeries, and handled most of the difficult cases, and also got an opportunity to work with the tribal population of Jawadi Hills and various parts of India with the rural units. I am also a privileged doctor who worked with the Malankara Orthodox Syrian Church, a missionary working team, and I got an opportunity to train the primary birth care attendants of Pudukkottai district. I have been one of the district instructor by Indian Academy of Pediatrics to train this primary birth care attendants. In this recognition of this training this primary birth care attendants, I have received the prestigious Dr. Kamini Rao Oration Award under the age group of 40 years, four among the gynecologists across the country to receive this award under the age group of 40. I also received the prestigious fellow in Indian College of Obs and Gynae in the year 2022. In various other institutes, Naval Lignite Corporation, also in the Vinayaka Mission Medical College and Research Foundation for about 2 years, nearly more than 15 years of work experience. The workload and the amount of delivery and difficult cases handled speaks for itself. In future, I would like to impart the clinical skills more to a medical graduate. Even if they have to serve in the remotest of the remote in the country, they should be well equipped with their clinical acumen and the skill too. Because also it's important, they will be the treating doctor for me. So it's my duty to give this back to the students so that I can get a better doctor in future. And the aim of the future should be to, I have in the process of applying a patency for this community teaching tools, which is prepared with the help of the locally available material. This rural unit or a rural population can connect immediately, or they should get synchronized so that they will understand what I am talking. The jargon that I am going to tell to them should not be a Greek and Latin. They should be able to imbibe. So preparing an educational video and getting it patterned is my future plan. Clinical skill and making a manual for the undergraduate students to get a clinical acumen is the future plan and the vision forward for the teaching, which is under process, it is in pipeline. Okay, soon we are going to publish the same thing.